Do you know the signs of diabetes that can appear at night? This is a question that may not come to your mind regularly, but understanding the symptoms of this common but serious health problem can make all the difference. Today, we will explore the subtle but significant signs of diabetes that often manifest during the night. These nocturnal indications offer valuable information on the underlying health problems. Before we dive into the topic, make sure to subscribe and leave a comment. It really helps us out and keeps us motivated to bring you more content. Let's get started. First, one of the first symptoms of diabetes is often manifested by a mixed reaction. If you wake up several times at night to empty your toilet, your sleep rhythm could be disturbed, which could potentially be a sign of diabetes. This is because when you suffer from diabetes, an excess of sugar or glucose accumulates in your blood circulation. Your kidneys must do extra hours to filter and absorb excess sugar. If the kidneys cannot keep up with the rhythm, extra glucose is excreted in the urine, causing the fluids in your tissues, which increases the frequency of your mixtures. This physiological response is an attempt by your body to eliminate the excess sugar and may be a sign of the diabetes. Secondly, night sweats are another crucial symptom to take into account. If you wake up frequently in the middle of the night sweating, this could be an indicative sign of diabetes. Nocturnal sweats are usually caused by a low sugar level in the blood at night, known as nocturnal hypoglycemia. This occurs when your body releases emergency hormones in response to low sugar levels, leading to excessive perspiration. Adjusting the dosage of medicines and eating habits can also help better manage night sweats in diabetics. However, these changes must only be made under the supervision of a professional. Before addressing the next symptom, do not forget to like and subscribe. Third, the symptoms of hypoglycemia. Not only the perspiration and tremors, but also a notable increase in hunger, confusion, a blurry vision, and even heart palpitations can occur at night. Hypoglycemia, or hypoglycemia, is a condition most often associated with diabetes. The reason why these symptoms are mainly manifested at night is due to the need for energy in the body to rest. When glucose levels drop, by showing these symptoms in order to indicate the need for an increase in glycemic activity. The management of these symptoms involves regular monitoring of glycemic activity and a balanced meal. In addition, it is crucial to discuss with health professionals about all medicines, because some medicines can affect glycemic activity. In some cases, a night snack containing complex glucose and proteins can be recommended to maintain stable glycemic activity throughout the night. The fourth sign is leg syndrome without rest, a neurological disorder often underestimated but fairly widespread. This condition is marked by an uncontrollable and irresistible desire to move legs. This desire often comes with strange and uncomfortable sensations in the deepest part of the legs, have been assimilated to curvature, chafing, or even a frightening sensation. Now, you may be wondering about the link between this syndrome and diabetes. The link actually lies in the nerves. A high blood sugar level, characteristic of diabetes, can damage the nerves of your body over time. This condition, known as peripheral neuropathy, is a common complication of diabetes and can lead to the appearance of leg syndrome without rest. The damaged nerves send contradictory signals to the brain, leading to the feeling of constantly having to move your legs. So if you feel uncomfortable or an irresistible desire to move your legs, this could be a good idea to check your glycemic system. Sleep disorder, called sleep apnea, occupies fifth place on our list. It is a condition linked to sleep characterized by frequent respiratory pauses during sleep. These pauses or apneas can occur several times during a night, which leads to intermittent sleep and often leaves the individual tired the next day. The link between sleep apnea and diabetes is particularly remarkable. Scientific research have shown that people with diabetes, especially type 2, are much more likely to suffer from sleep apnea. The reason behind this is multiple. A key factor is that the two conditions are associated with obesity. When an excess of fat accumulates around the neck, it can obstruct the respiratory tract, leading to sleep apnea. In addition, the metabolic disturbances caused by diabetes, such as insulin resistance, can directly contribute to the development of sleep apnea. Insulin resistance can lead to imbalance in the energy consumption of the body during sleep, causing interruptions in breathing. This complex interaction of factors leads to a higher risk of sleep apnea in people with diabetes. Moving on, we come to the symptoms of an increased thirst, also known as polydipsia. If you wake up frequently at night with a dry mouth and you feel unusually dry, this could very well be a sign of diabetes. This is caused by a high blood sugar level, which forces your kidneys to do extra hours to filter and absorb excess sugar. When they fail to follow, excess sugar is excreted in the urine. This causes more frequent mictions, which can dehydrate you, hence the increased thirst. The management of this particular symptom involves controlling your glycemic system, regular monitoring, balanced diet, regular physical activity, and medicines if prescribed by your doctor. It is essential to consult your doctor to know the best ways to manage your symptoms, especially if it comes with other symptoms of diabetes, because it is your body that signals that something is not right. The seventh sign to watch out for is fatigue. If you feel constantly tired despite 16 hours of essential sleep, this can be an indication of diabetes. The fatigue associated with diabetes is due to the inability of the body to use glucose efficiently as a source of energy. When your body cannot convert food into energy due to lack of insulin or insulin resistance, you could feel constantly tired. It is because cells are deprived of glucose, which they need to function optimally. The management of the fatigue associated with diabetes involves maintaining a stable glycemic system, which can be done through regular physical activity, balanced diet, and regular exams with your health professional. It is important to take care of those who have sufficient rest and those who have the minimum level of stress. Relaxation and stress management are also crucial in managing the fatigue associated with diabetes. Dry mouth, known medically as xerostomia, is another notable symptom that needs to be watched out for. Characterized by a lack of saliva, individuals can wake up frequently with their mouth dry despite the adequate level of hydration. This could potentially be a sign of diabetes. This symptom occurs because a high sugar level in the blood can reduce the production of saliva, leading to a dry mouth. A high glycemic level can also lead to an increase in the mixture and then a dry mouth. Managing CE symptoms involves maintaining good oral hygiene, staying hydrated, and using saline substitutes or stimulants if necessary. Sucking gum without sugar or sucking candy without sugar can also help stimulate the production of saline. Consulting a health professional is always recommended to diagnose and treat this condition with precision. The last point to note is the occurrence of sleep disorders. If you suffer from insomnia or face other nighttime agitations, this is probably linked to diabetes. Sleep chronic disorders are often observed in diabetic people due to the inability of the body to regulate glycemic activity, causing hypoglycemia or nighttime hyperglycemia. Hypoglycemia can trigger symptoms such as perspiration and tremors that can wake you up in the middle of the night. On the other hand, hyperglycemia or high glycemia can cause frequent emulsions, leading to several trips to the toilet at night. The management of these sleep disorders generally involves better control of glycemia and exercise. Therapies such as behavioral cognitive therapy can also be beneficial to fight insomnia. Thus, if you have trouble sleeping, it is essential to consider the possibility of diabetes and consult a health professional for a diagnosis and precise treatment. In summary, the signs of diabetes that can appear at night include frequent mictions, night sweats, hypoglycemic symptoms, leg syndrome, sleep apnea, hangover, fatigue, dry mouth, and sleep disorders. Do not forget that these symptoms are not a definitive proof of diabetes, but they can indicate the need for medical consultation. It is always preferable to consult a health professional if you present one of these symptoms. Diabetes is a disease that affects millions of people around the world. Being aware of signs, especially those that occur at night, can help detect and manage early. What about you? Do you have diabetes or know someone who does? Let us know in the comments, and don't forget to subscribe so you don't miss anything.